I've got up here is a pie and a number, 141 billion. I'm sure everyone in this room knows that that 141 billion is what in Canada we are supposed to have spent from the public sector on health care in 2011. Now, all the talk yesterday about public and private coming together, so if I had an eraser and I could erase that, I'd do that and I'd change it to 200 billion because that's what we spent as a nation on health care. The point I want to make is it doesn't matter what number we're talking about here. When we look at this pie, there's a couple of ways of looking at it. One way is this 140 billion or this 200 billion is what is our healthcare expenditure. It's what we spend on healthcare in Canada. The other way of looking at it is it's our healthcare investment. It's what we invest in the healthcare of Canadians. Now, in order to do the latter, we kind of have to look at it as a system, but unfortunately, we don't really have much of a system, and we've heard lots of that over the last couple of days, so we tend to try to manage it in component parts, and that's reasonable and that's understandable. And this conference is a Pharmacare conference, and so it's about managing that part of the pie right there, for those of you, that is Pharmacare. That's what we spend on medicines in Canada. Now, I was introduced as being from GSK. I need to clarify that I am from GSK, but I'm actually from here representing Rx&D, Canada's innovative pharmaceutical industry. And the whole point, I guess, is we're the reason for that green wedge. We're the reason you spend that money there. But I'm proud to stand up here and say that it's because we discover, develop, and bring to market innovative medicines. Now, I suspect there are a few people in this room that think that wedge is too big. Maybe there's a couple people in this room that think the wedge is too small. I don't know. I don't know if any of us know how big it's supposed to be or how small it's supposed to be because we don't look at it in the entirety of the system. We don't look at it relative to the broader components of the system. We have no regard for, as we've heard this morning, for the outcomes that these medicines are designed to deliver, positive or the negative outcomes that they deliver. We're unable to pay attention to that. But what you did was ask us, and I appreciate the opportunity to represent our industry, be here to speak to our vision of Pharmacare. And in order to speak to our vision, I need to help you understand what our perspective of Pharmacare today is. Many of you may disagree with it. It's just our opinion. That's what we were asked for, so I wanted to present it. Our current understanding of Pharmacare to us is that it's basically an isolated cost containment system, and we've just talked about that. It's a wedge. It's wedge management. It's understandable, but that's what it is. It's a management of that wedge. It's a management of the supply of these medicines, of these commodities, as they've been referred to, or whatever you want to call them. It's managing that supply. It's a one-size-fits-all. Now, from a policy perspective, that's laudable, and I clearly understand and support that in the effort of treating everyone the same. But that's what it is from our perspective. It's fractured. We've heard that word a couple of times already this morning, and to me, what that means is everyone at this table, everyone in this room has a vested interest and I guess a bias with respect to Pharmacare. But we're not doing a great job of bringing those together and taking advantage of that. And finally, it's unsustainable. I think we all know that. With the demographics, with the new drugs that are coming on, with the other costs to the system, it's clearly unsustainable. So what's our vision for the future? We need cost management. We need cost control. We need prudent fiscal control. No one would argue that. But I think in doing that, we need holistic control as well. Let's think of the broader system. Let's think of how these elements interplay. And one of the ways to do that, and I heard this morning at least a couple of times, let's focus on some of the outcomes. Why do we buy medicines? Why do we pay for medicines in the first place? We pay for them because they're supposed to deliver some kind of healthcare value, some kind of outcome. But if we don't measure those outcomes, the only thing we have to look at as a metric is what we spend on them. And then we're back to, well, is it too much or too little? I don't know. It's a relative number. Equal yet individualized. So the idea of one size fits all is in the spirit of treating everyone the same. But in our mind, sameness is not equality. If you and I have different conditions, we don't need to be treated the same, but we need to be treated equally. And what that leads to is some individualization, which I know from a policy perspective is a very tough thing to do. But I think we need to try to aspire to it as Canadians. Cooperative, clearly the opposite of fractured. Physicians, pharmacists, patients, all industry, we all have something to bring to the table, and we better start doing it. We're all Canadians, and we're all moving towards that time in our life when we're going to need more of this system. And the sustainability, I think that's self-evident. I haven't heard anyone say we don't have enough money in the system, but we're not treating it properly. So now for the big finish, I think we go from, if we can start to put some of these principles and what we've heard today, we can maybe move from Pharmacare to patient care or to people care. Now, I have to apologize for how hokey this looks. I did not mean for it to be so early in the morning, such a hokey finish, but what I'm trying to say is that we're looking at reforming Pharmacare. Let's think about the broader system, and let's think about the ultimate objective of patient care or people care. Thanks.